Hello, my name is Joseph Clark, and my presentation is about sepsis. So, what is sepsis? Well, sepsis is when any pathogenic infection causes SIRS. Now, SIRS is literally checklist. If you can check off two of the four following four items, then it is SIRS. So that is going to be having a body temperature below 96 or above 101, having tachycardia, having tachypnea, having a white blood cell count less than 4,000 or higher than 12,000, then that's all you need to do to check the boxes. Now, if and only if an infection caused SIRS, then the patient is diagnosed with sepsis. Now here I have a diagram that reiterates that point, and it's to show that you can have a condition where you have SIRS, but it was not induced by an infection. And there are cases where you can have an infection that does not correlate to SIRS in any case. So you can have a cold, and that's not going to cause SIRS, in which case, you're not going to be diagnosed with sepsis. But if you have both an infection and SIRS and they're correlated, then you have sepsis. Now, if sepsis is left untreated for a period of time, then you will have severe sepsis. And this is usually marked by the start of an organ starting to shut down, or you can have blood vessels starting to vasodilate. And then if that's left for too long, then you can have septic shock. Now, this is when you start to really see the blood pressure starting to drop because of the extreme vasodilation. And of course, septic shock can lead to death. So let's talk about what makes sepsis so dangerous. Sepsis is really a two-headed monster here. You have the infection from the pathogen itself that is still attacking your body, but you also have your body itself that doesn't really know how to fight it. So as the name implies, the systemic immune response syndrome, it is systemically responding. It's not just responding to where the infection is at. So what can happen is you can start to have extreme edema because you are having such vasodilation, which is basically creating a flood of fluids and various seemingly random parts of your body potentially. So for me personally, that was my left leg. There was just an extreme edema that happened, and it even shredded my Achilles tendon because there was just such a pressure there. But I got lucky because that is where my body decided that it needed to do that. Whereas if it happened to, say, my heart, my lungs, my brain, that would have been certain death. And this is where sepsis can be dangerous, because if one of those organs does become the victim of sudden flooding like that, then you're almost certainly, your organ will shut down. And if multiple organs start to shut down, then you have multiple organ dysfunction syndrome, or MODS. And if you're not already under treatment by that point, you're dead. Now comes the most important question: what is the causative agent of sepsis? And the answer to that is pretty much anything that can grow inside of your body. So the most common form of sepsis is a bacterial sepsis, specifically bacterial pneumonia. However, any form of bacteria that can grow in your body, any form of fungus that can grow in your body, protozoa, virus, they can all cause sepsis. It is to be noted that while bacteria is the most common form by far, approximately 10% of all sepsis cases are fungal. Now, those most at risk for sepsis are going to be the same people who are most at risk for any other type of infection. So you're going to be talking about your immunosuppressed or immunocompromised, your really young babies, your really old adults, pregnant women, those that are inside of high-risk areas such as hospitals. And the other diagram here is to really bring home the point that sepsis is an extremely dangerous condition. So 20,000 people die from this every single day. So this is nothing that you should just look at and not pay attention to. So even though these symptoms look a lot like common flu symptoms, I can attest to someone who has had both the flu and septic shock that you know when you have something more than just the flu, because this is going to be something that is going to put you down and not make you want to get up again. Moreover than that, you continuously feel worse and worse and worse because you can actually start to feel your body shutting down effectively. So be on the lookout for having all the flu-like symptoms, but dialed up to 10. So the first hour of diagnosing sepsis is going to be the most important time to treat. So the first thing you want to do is measure and remeasure the lactate levels in the patient to make sure that there is a growth inside the bloodstream, which means that you really need to start getting to work. After that, you're going to want to obtain a blood culture before administering antibiotics, because you don't want those antibiotics to potentially kill whatever your culture is, so that way you can observe it and know exactly what it is you're fighting. And then you're going to want to administer broad spectrum antibiotics. You're just going to want to start wiping out any kind of bacterial infection as soon as possible. You're going to assume it's a bacterial infection until you know otherwise. You're going to start giving rapid administration of crystalloid or saline solutions. You're just trying to increase that blood pressure. You're trying to make it where you have stabilized your atrial pressure. And again, you're going to even administer vasopressors until that atrial pressure is stabilized. So after that, you're going to determine the infectious pathogen by taking the blood sample and running it and evaluating through PCR. After that, you're going to proceed with an antimicrobial sensitivity test, which is going to determine what exact pathogen-specific drugs you'll be treating the patient with. So after that, you can do all the normal procedures with treating the pain, monitoring the vitals, fluid balance, O2 levels, just making sure that the patient is otherwise healthy. Now, the reason that fungal sepsis is much more deadly than bacterial sepsis is that this has been a 4 to 8 hour window running the PCR, determining if this is actually fungal or not. And while he has had a general broad span antibiotic that has potentially taken care of his infection, if this is a fungal infection, he will not be able to receive treatment for another 8 hours. So this is why there is a doubling amount of mortality with a fungal form of sepsis as opposed to a bacterial form of sepsis. So I know it sounds cheesy, but the best way to avoid sepsis is to just not get sick. Now, obviously, everybody gets sick, but you can take steps to reduce your risks. So you can wash your hands often. You can take a flu shot every year. You can keep up to date with your vaccinations. But also, an underappreciated one is that you can maintain a proper and healthy diet and lifestyle, which means sleeping regularly, exercising regularly, eating the right things, getting an annual appointment, and so on. And that is my presentation on sepsis. Thank you very much.